So our next speaker is a renal dietitian with a background in sport. Multiple awards for his research. Welcome on stage, Oscar.
Excellent. There we are. Can you all hear me? Okay. Excellent. Good. So yes, my name is Oscar. I'm a kidney dietitian. I'm sure you've met some of my colleagues and people like me around the country as well. What I want to do today is go over kind of what a kidney diet is, because it should be different for everybody, and also going over potential changes in evidence and hopefully ways that we can support your care and essentially be less of the bad cop and much more approachable as well. So in terms of conflicts of interest, I do have some, here they are. And in terms of what I want to go through today, is painting the scene of, firstly, what your kidney does. You probably know better than me what it does, but how food can support your kidney function and support your treatment over time. It can be what we should be doing as a profession and how we should be supporting you as well. And then it's going through different stages of kidney disease and how advice is subtly starting to change, and hopefully ways that can support you in doing what you want and living your life in a way you want to, while still supporting your kidney function as best you can. And lastly, it will be other ways outside of diet that aren't represented today that can also support your kidney function as well, and also give you a bit of flexibility with your lifestyle, which is where the sporting background comes into play as well. So in terms of why diet is important, well, it's all down to what your kidney does for you. It's a brilliant organ. It filters a huge amount of blood, and when it does this, it gets rid of waste, it gets rid of minerals, electrolytes. It helps to manage your blood pressure through managing your fluid. It helps to support your heart and support your brain, and also it supports your bones. So you mentioned hungry bone syndrome. Your kidney plays a very important part in balancing out how strong your bones come to be and your bone metabolism as well. In terms of what diet can do for you, there are certain tweaks you can make to reduce your blood pressure and have a huge impact on your blood pressure control. There are a few tweaks we can do to reduce, a phrase that I'll use quite broadly is workload or pressure upon your kidney. And a few things you can do to not just support your kidney function, but to support the medications that you are prescribed as well, and ideally reduce your medication burden, your dialysis burden where possible as well. So in terms of changes, I'll jump on to the next slide, what your dietitian ideally should do for you, it's used an evidence-based foundation, so we should all sing from the same prayer book, give you a firm foundation of advice, but it's doing it in a way that suits you, not just, like you mentioned before, being told what to do, but working with you to find out, well, you know, what's your daily life like, what burdens do you have that we need to work around, what lines do we need to colour within to support you in your dietary approach, but also support you in your quality of life as well. It's using guidance to help you learn about how your dietary choices can affect your kidney, your other organs, and your treatment, to rationalise and help you understand as well, rather than me just saying, eat less salt, it's explaining why, or avoid these vegetables. It's talking about different cooking methods as well, because just being told doesn't really get you on side, it doesn't help you understand. So in terms of, with that being said, I'm now going to tell you the different points of how diet can affect your kidney function at different stages, and also hopefully some simple, easy steps everyone can apply to themselves regardless of their stage in their kidney journey, in their kidney management as well. So in terms of what to consider, what's often phrased from the medical point of view is a leaky kidney. It's helping to reduce the leak from that kidney and helping to reduce the pressure upon that kidney. The first thing we'll always approach is low salt diet. Have any of you, I'm assuming everyone's been told about a low salt diet. In terms of a figure, it's 5 grams of salt, but in terms of a number or what it is, it's a tablespoon. I'm just going to ask for nods or shakes. How many of you in this room think the average typical person eats less than a tablespoon of salt a day? Do you think most people do? No. The global intake averages at about double this, 11 grams of salt. The typical variation is 7 to 14 grams, so at a starting point, there's a huge amount we can do, but it's not always as easy as just eating less. because the majority of it, that's just for Europe, it's about 9 grams. The majority of people don't typically add salt to their meals. It's already what's hidden in there. So the first thing we can do is trying to reduce the addition of table salt into your food or the use of high salt condiments. But how many people here still add salt to their meals? And you can say, yes, I'm not going to judge you if you do, don't worry. Yeah. So not everyone, it's not a common thing these days. So the main thing we need to do is look away from using packaged foods where possible, or where easy, where doable, is moving toward a whole food approach. And people may say, well, I've been told to eat less vegetables, I've been told to eat less fruit. Well, this is where we can push toward it. So in terms of a whole food approach, it can be tinned, it can be frozen, it can even be microwave, steam bags is fine. It's trying to move away from typically very easy meals to go to like microwave meals, or where possible, doing your best impression of Sherlock Holmes, essentially. So it's looking at the traffic lights on the front of food labels and doing it in an easy to approach manner. The first thing is trying to work out, well, how much salt do I eat? And this is where you can start to hopefully talk to your friendly neighborhood dietitian about trying to guess how much salt do you eat, and trying to work toward what foods you typically take in that are high in salt and what easy alternatives there are, not just dogmatically saying get rid of massive food groups. So what we'd try and do is work with you to look at the traffic light labels on the front of food boxes, or if you really want to get in depth, it can be looking onto the back of food boxes. So for traffic lights, do you want to aim for green? For the back of the boxes, you want to aim for less than 0.3 grams of salt per 100. A very easy thing for me to say. In practicality, I would say find out what you currently eat and try to go down step by step, step by step. It will be a process, not an immediate change. And we also want to look at other ways to reduce pressure upon your kidney. So it does look at other medical conditions you have. So diabetes control, even at very early stages, can reduce pressure upon your kidney infiltration through. And again, this is where we can push toward a whole food approach, prioritizing grains, prioritizing fruit and vegetables, and trying to move away from overly processed convenience foods where feasible as well. Easy for me to say, it's about what you do day to day and how we can apply it to you as well. And in terms of what we want to focus on, for me, in terms of sport, it's protein. So there's a huge focus on reviewing your protein intake during dialysis and before dialysis. And the reason for this, it can affect your kidneys when they're filtering things through. If you have a very, very high protein intake and your kidneys leak protein, having a huge intake of protein can put more pressure on your kidneys and encourage wear and tear. But what you can do is, at very early stages, if you have urine protein present in your urine, it can be to reduce your intake of ideally red meats where possible, or processed meats, and try and push toward things like pulses, legumes, fish, poultry as well. And in terms of if you are very active, like you mentioned, badminton, it's discussing it with your dietitian and finding a compromise as well. We want to support your muscle mass and support your strength whilst also supporting your kidneys as well. And the advice is fairly consistent through different stages of kidney disease and kidney management. The same thing happens in the latter stages. We want to emphasize minimizing salt intake where we can. And the reason for this is a higher salt diet can put more pressure on your kidneys, it can increase your blood pressure, and reducing your salt directly influences your blood pressure. It directly influences how much fluid you hold on your body. And in the latter stages, depending on what medications you take, salt intake directly influences how effective these medications are as well. The lower your salt intake, the more effective medications like ramipril and losartan can be. So you're actively supporting not just your kidney function, but your medication management, and hopefully reducing your medication burden as well. It can also, very poignant timing, help to manage your thirst. If you can think of having a very salty snack, you'll be thirsty afterwards like I am right now. And in terms of managing your thirst, again, if you have to stick to, say, a food restriction, there are certain tactics we can use to help support your thirst management, such as frozen fruit skewers, flavored ice cubes, and then also it's a case of minimizing your salt intake where we can as well. Sorry. Now, in terms of fruit and vegetables in the later stages of kidney disease, there's often been quite a dogma about things like bananas, tomatoes, mushrooms, and the potassium content, which we will come to. But current guidelines do suggest we should move more toward a higher intake of fruits and vegetables because it's supportive for your blood pressure management, it's supportive for your kidney therapy, but it's preparing these foods in different ways, which we will touch on in a minute. And in terms of protein, this is treated with even more scrutiny at the latter stages of kidney disease. So in terms of potassium, again, this can be a nod or a shake. How many of you here have been spoken to about potassium in your diet at some point? There's a few, yeah. It's a very common discussion, bless you. So what potassium does, it helps to control your muscle contractions. That's the main function of it. And the reason why we get so finicky about it is one of these muscles is your heart, which is a very important muscle. But hopefully what we can look at is other ways of controlling your potassium. One of the main ways is the food and drink that you eat, which is why we get involved and we get so dogmatically involved. But other things can affect it, like your bowels. If you, say, are someone who open your bowels quite irregularly, that can increase your potassium absorption. So rather than limiting what small food you enjoy, we can look at support your bowel management to help to control your potassium levels. Another way can be your medications. These are very valuable for your kidney. They will also affect your potassium levels potentially. So what we need to do is look at ways to support potassium management to help support your kidneys around your medications. Lastly, it can be your bloods. Your kidneys are very good at regulating your body's acidity. This affects your muscle mass, and also it affects potassium levels. Another one is blood sugars as well. Blood sugars can also affect your potassium levels if they're very high. So there are a number of ways we can look at tweaking your potassium levels rather than just your food. And if we jump on a second, it can be about where you get your food from. So one of the common things like salt, potassium is present in food, but it's not always potassium, it's often potassium added into your food. So added potassium we absorb 100% of in our gut, whereas potassium from things like fruits or vegetables, we absorb about 60 to 80%, so we absorb a little bit less. And we can further address this absorption of potassium can be soaking vegetables, and it hasn't got to be for 2 or 3 hours. It can be blanching them for 10 minutes in a big pot. You can look at using tinned beans, tinned vegetables, tinned fruits, and then pouring that liquid away as a way to reduce the potassium content. Or you can look at, if you do a lot of stews or stir fries, quickly pre-soaking your vegetables as a way to reduce the potassium content and still enjoy them. They haven't got to be boiled to death. If you prefer them crunchy, you can just do them for about 10 minutes in a very big pot of water as well. The other electrolyte we get very focused on is phosphate. It can affect your bones, and it can also potentially affect your itch. One of the things we look at is it going too high or too low. It can go either way. And in terms of guidelines, there currently is a big investigation into how your phosphate affects both your body and your bones. So the current guidelines do mention trying to look at modifying your dietary intake, but it's the same as potassium. Other things affect your phosphate absorption. So it can be, again, your digestion. If your gut is very slow, you absorb more phosphate. It can be misdialysis treatment can affect it as well. Can be medications. Some can absorb phosphate and help you get rid of it. Some potentially can push it up depending on what you take. And lastly, it can be food and fluid. And it's the same focus again. It's inorganic phosphate, so added phosphate from things like baking powder or raising agents, dark sodas, certain E numbers, we absorb 100% of, we absorb loads of. But phosphate from things like nuts, seeds, pulses, we only absorb about 20 to 50% depending on how they're prepared. So it's not just what you eat, it's the source. So you should hopefully still be able to enjoy whole foods, nuts and seeds. And again, this aligns with the other recommendations we're trying to promote of a whole food diet as well. Now, in terms of protein, this is where it does change quite a lot depending on your treatment. So protein before dialysis, we want to keep it a little bit lower, but what protein does is it's a building block for our muscles, it's a building block for our tissues, it's a building block for our organs. So what we typically see is you eat protein. When you break it down, it goes into these building blocks called amino acids, and during this, we produce urea, we produce acid as well, and if we eat too much protein at once, we have to urinate the amino acids out to excrete it, and that does put a little bit more pressure on our kidneys, which is why we want protein intake to be a little bit lower. But what we want to do is look at the current focus, which is plant protein versus animal protein, and should it really be a versus approach? So depending on guidelines and depending on sources, animal protein is highlighted as being very biologically valuable. So we get much more amino acids from protein from animal protein than we do from plant-based protein. But it shouldn't be a versus approach. It should be having potentially a small amount of animal-based protein from fish or poultry and trying to move the meter a bit towards seeds, nuts, pulses. It can be tinned, they can be fresh, they can be dried, as a way to maintain an adequate protein intake but have it be gentler upon your kidneys as well. Now this does somewhat change when you get to dialysis, but before that we often get questions in clinic about what's the best dietary approach. They highlight things like plant-based dietary approaches, Mediterranean, the DASH, which is the dietary approach to stop hypertension. And before we crown a champion, we have to look at their undercurrents. So they're all low salt, they're all low processed food, they're all high vegetable, high fruit, and they're typically all high fiber. So if we look at them at their essence, they're all the same dietary approach wearing a different disguise. What we want to do is promote a lower salt intake, a higher intake of fruits and vegetables, and try and move toward a whole food vegetable intake for protein, not very processed plant-based protein sources that can be very high in salt. So it's trying to move back toward basics where possible. The main dietary champion is the one that you can do, and that's what your dietitian should work toward. It's working toward a dietary approach that you can do, that works for you, and that you can maintain long term. Now in terms of changes, the big change, just aware of time, can be around the different kinds of dialysis that you have, and then it can be post-transplant as well. So in terms of for dialysis, if we focus on different kinds of, first we have tummy dialysis, peritoneal dialysis, PD, and what dialysis does is it aims to remove fluid, toxins, and waste products that build up in the body. What we often want to support in terms of a dietary approach is you still weeing. Essentially, we want to support your residual kidney function, and that's how diet can help. It's pushing on that low salt diet where possible, and it can also be supporting your fluid management where needed. If your residual function is starting to go, you're starting to wee less, it can be looking at how to support your thirst and how to modify your fluid intake. And lastly, it's an individualized approach around potassium, around phosphate. Not everyone needs a low potassium diet or a low phosphate diet. We should move away from this approach and move more toward what do your blood say, what do you need as an individual person as well. In terms of hemodialysis, that's the American spelling, I'm aware. It does the same thing, it removes toxins, it removes fluid. How diet can help and how it changes slightly is you will start to potentially lose the ability to wee the longer you stay on hemodialysis. So it's much more around that thirst management and that fluid management. And again, it's that individualized approach for potassium or phosphate and trying to get your diet to suit you and suit your lifestyle where possible as well, to make it one that you can maintain. The big focus is protein on dialysis. So this is where it likens towards sport as well. So what do you do before dialysis is we review protein intake and we potentially try to rein it in where feasible. What we need to do when you get onto dialysis is make sure you get enough protein. We have to kind of do a 180 essentially. And the reason for this is every time you do dialysis, like exercise, you create a protein need. So when you do dialysis, you lose protein. When you do exercise, your muscles break down and you create a need for protein as well. And what we have to do is, it depends on what kind of dialysis you have and how often you have it. So for hemodialysis, people will typically have between 2 and 4 sessions a week. The mean is 3 sessions a week. And you lose just over an egg per session of dialysis. And depending on the kind of dialysis you have, you may lose a little bit more than this. And what we do over time is, say if this isn't corrected for weeks and weeks, for months and months, is we start to form some kind of muscle wastage and protein debt. So what we want to do is look at it in terms of how do you adjust. So protein intake on dialysis, over a week you potentially lose 6 eggs a week. The minimum can be 3. So we need to adjust your diet where possible and try to increase your protein intake. And this is even more prescient with the different forms of dialysis. So with peritoneal dialysis, you lose a little bit less protein per session, but people are typically on peritoneal dialysis a little bit more often, maybe 5, maybe 7 days a week. So the overall protein loss can range up to 70 grams of protein a week. It's a huge amount. So is it always easier for us to say, well, we just need to eat more meat, we just need to eat more chicken, more fish, more seeds, more nuts? Not always, because in terms of thinking of your own experiences, how many of you, when you were just coming onto dialysis or just having treatment, were ravenously hungry? I don't think many of you were. I'm not seeing anyone. We've got one person. Very good on you, sir. Good plan. But in terms of appetite, not many people eat enough. So before dialysis, about a third of people don't meet their estimated dietary requirements. It is an estimate at best, but we think that they don't eat enough. And when this gets onto dialysis treatment, only a quarter of people eat enough energy and eat enough protein. So it's about not just before dialysis how we help you modify your salt intake, but it can be on dialysis. How do we keep you strong? How do we keep you independent? And how do we keep you ideally fit enough to do what you want to do? And in terms of our bag of tricks, you'll often see us come to you and you'll panic about, do I have to have those supplements, build-up drinks? We can do IV nutrition as well. They can be very useful. What we should approach you at first with is, what do you eat is the main thing, and how can we help you make it either more calorie dense, more enjoyable? So it can be food fortification to help build up the energy that you take in. It can be supporting with taste changes, so people will find that their taste, they either get a very metallic aftertaste, they lose their sense of taste when it comes to food. So it's looking at, can we do easy ways to get more energy into you? Can we do easy tweaks to help you change your taste by using different seasonings, different flavorings, different temperatures? And it can be, how can we support you with your thirst? There's nothing worse than sitting down for a big meal and then you have no saliva in your mouth. So it's how can we help you produce more saliva potentially to help make the eating experience more enjoyable. It's not about just getting more in you, it's how do we help you with this? And this is what dietitians should do. We should be individualized to support you in your day-to-day needs and doing it in a way that suits you, not just here's a leaflet, here's a supplement, on your way. It should be personable. In terms of after transplant, what we can do is look at how your appetite may change and also maintaining that low salt diet, again, because that will reduce pressure upon the new kidney and reduce pressure upon your old kidneys. In terms of potassium and phosphate, it can go either way. Again, it should be individualized, and it should be considering the impact of your medication in terms of hunger, in terms of medication load, medication timing, and it can be looking at other ways to support your kidney management and the risk of diabetes after transplant, which is the phrase no DAT, no onset diabetes after transplant. Diet can have an impact, but it can be down to the medications. Apart from exercise, or apart from diet, exercise can have a huge impact on your dietary management and your kidneys. So numbers, easy for me to say, aim for 150 minutes a week or 75 minutes a week. Is doing more where you can and doing more of what you enjoy. So in terms of exercise, you should be able to exercise even if you're on dialysis, hemodialysis or peritoneal dialysis. It has a huge benefit for your diabetes management, for your blood pressure, for your inflammation and for your residual kidney function. And in terms of exercise, it hasn't got to be resistance training or weights. It can just be more steps than you do currently as well. Has been shown to, it's associated with a lower level of inflammation, but this hasn't been repeated in interventional trials. But it can be small changes in your behavior, just like dietary approaches as well. Lastly, it should be useful resources or where else you can go. If you haven't got access to a dietitian, it can be looking at other sources. So the National Kidney Federation has a good range of recipe booklets and diet booklets. There's also a group called the Kidney Dietitian Specialist Group run by the BDA, which is our kind of governing body. They have an impact in terms of what we do. They have a very good resource guide as well. And lastly, it can be your trust. It can be looking at what resources your trust creates for you. And ideally, it's making use of a kidney dietitian if you have one available. And potentially, if you don't like the way that they approach subjects in clinic or with you, tell them this so they can adjust their practice, because it should be based around what you need and not potentially what they think you need as well. Thank you very much for your time. My take-home points are, again, a bingo card of minimize your salt intake where you can. Try and move more toward fruits and vegetables with potential to change how you prepare them. And it can be, the dietary advice should change, and it should change depending on your bloods. It should not be consistent throughout. And lastly, it can be the fact that getting more protein can be helpful on dialysis, but it's just about getting enough protein. Giving you more and more and more isn't necessarily going to be helpful. It's about getting enough, both in terms of protein, energy, and micronutrients as well. Thank you very much for your time. I appreciate I've run over slightly.
Ladies and gentlemen, Oscar Walton.
Thank you very much.
We'll do questions afterwards.